I'm Lori Andrade. I'm the Executive Vice President leading the Social Care Network for Long Island. We're a network of 100 community-based organizations and healthcare providers coming together to coordinate and integrate healthcare and social care. So we've really built a really strong network. We already started with a strong network, being a coalition to begin with that was really based on transparency and collective leadership, but we've really expanded upon that and brought on healthcare providers. All of our health systems participate in the network, as well as our federally qualified health centers, as well as primary care practices across Long Island as well, and then CBOs coming in and really engaging and really, starting out just kind of coming into contract and participating, but really now starting to deliver the services. We've screened over 35,000 Medicaid members on Long Island and connected them to services, and we're only building from here. I think we'll just continue to expand and strengthen the network. That really is what it's about, is having a cohesive network of providers who want to coordinate care, share information about Medicaid members to connect them to services. UnitedHealth has been really key in that from the get-go and continues to be a really critical piece of being able to coordinate care, share information, and coordinate care. So I really just see it continuing to build momentum over time, more services to be delivered, and really to look for those opportunities, pilot opportunities to do some really unique coordination. How do we look at how putting some of the nutrition services in our federally qualified health centers? How do we think about seniors aging in place through some of the home remediation services? How do we think about other ways to integrate social care and healthcare, particularly with a focus on primary care and prevention? There's a lot of success stories, but certainly, providing those food boxes to families are really, really critical. So many times we've heard from our clients or Medicaid members that their children had, got to try fruits and vegetables they had never tried before, and that was exciting to them. And I think also the other piece is really our specific care model that we have, the utilization of CHWs to really provide that care, to have empathetic, patient-centric, holistic care. And I think that trust is so unique and special with the social care network because it's based on the role of the CHW in connecting people, being from community and connecting community to care. UnitedHealth has been integral in this piece. We started working with UnitedHealth back in 2017 during the first 1115 waiver when HEALI began, and they've been with us every step of the way. When those resources ended, what I call the lean years, UnitedHealth was with us, bringing our CBOs on, so that when we began the social care network with this waiver, we already had CBOs on UnitedHealth and understood how to utilize it. And then as this rolled out, really making sure, hand in hand, working on workflows. How do the workflows related to these services particularly also, how did that coordinate with how UnitedHealth works? And really, I know that we'll be partners continuing to move on forward as we think about what comes next in terms of thinking about additional disease prevention opportunities, as well as how do we advance whole person care.